The surprising connection between oral health and heart disease. Did you know that brushing your teeth properly could reduce your risk of a heart attack or stroke? While oral health is often overlooked, studies have shown a surprising link between gum disease and heart disease. What many don't realize is that the simple act of removing plaque from your teeth can significantly lower the risk of serious cardiovascular issues. In this article, we will dive deep into the science of plaque and tartar, how to effectively remove them at home, and how doing so can improve not just your smile, but also your overall health. And let's be real, who doesn't want a healthy smile and a healthy heart? The science behind plaque and tartar formation. Plaque is the sticky biofilm that forms on your teeth when food particles mix with bacteria. If left unchecked, plaque hardens over time and turns into tartar, which can only be removed by a professional cleaning. Tartar doesn't just affect the aesthetics of your smile, it can lead to gum inflammation, tooth decay, and even bad breath. Picture plaque as a sneaky intruder, silently building up on your teeth, while tartar is its hardened, much more stubborn counterpart. If you leave it unattended for too long, plaque and tartar might invite bacteria into your bloodstream, increasing your risk of systemic health issues. Personal story, the wake-up call. Let me tell you a story of my friend Linda. She never thought much about her oral health until one day she went to the dentist for a routine cleaning and was told she had a lot of tartar buildup. It wasn't just an aesthetic issue. Her gums were inflamed and she was at a higher risk of heart disease due to the bacteria entering her bloodstream through infected gums. That visit was a real wake-up call for Linda, and she quickly realized how crucial it was to maintain proper oral hygiene. Plaque removal, basic methods. The first and most essential step in removing plaque is brushing your teeth. But it's not just about brushing any old way, it's about brushing correctly. Brush with fluoride-free toothpaste, or even better, try natural alternatives like baking soda. Use a gentle circular motion and be sure to brush for at least 2 minutes twice a day. Brushing is like hitting the reset button for your mouth. It removes food particles before they can turn into bacteria. Here's an example. Imagine you had a spill of soda on your kitchen counter. If you don't clean it up right away, the sticky residue will build up. The same goes for your teeth. The longer you wait, the harder it becomes to clean. So make sure to brush frequently to avoid that buildup. The power of flossing, reaching the unreachable. Brushing may clean the surfaces of your teeth, but it doesn't always reach between them. Flossing is the best way to clean those in-between spaces. Flossing removes plaque and food debris that get trapped between teeth where your toothbrush can't reach. Not flossing regularly is like cleaning only half of your house. The other half will eventually get messy. Fun fact, if you're not flossing daily, you're missing about 40% of the surface area in your mouth. So floss like your oral health depends on it. Because it does. Water flossing, the game changer. Water flossers are a fantastic tool for plaque and tartar removal. Unlike traditional floss, water flossing uses a pressurized stream of water to flush away debris and bacteria from between your teeth and gums. It's especially helpful for people with braces or sensitive gums. I recently recommended a water flosser to my cousin, Tom, who had always struggled with getting plaque out from between his teeth. After using it for a few weeks, he noticed a significant improvement in his gum health. No more bleeding gums after flossing, and his dentist was impressed with the results during his last visit. Oral health and its connection to heart disease. You might be surprised to learn that the state of your mouth could have a significant impact on your heart health. When plaque and tartar build up, they can lead to gum disease, which causes inflammation. This inflammation can then trigger the release of substances that narrow blood vessels and increase the risk of heart disease. Take the study by Dr. David Vigorist, for example. His research showed that people with gum disease are 44% more likely to suffer from heart problems. That's a staggering number when you think about it. So by removing plaque and tartar, you are not just protecting your teeth, but also lowering the risk of heart attacks, strokes, and other serious health issues. How prediabetes and diabetes impact oral health. People with prediabetes or diabetes are at an increased risk for gum disease because high blood sugar levels can lead to inflammation. This creates a vicious cycle where poor oral health contributes to worsening diabetes, and uncontrolled diabetes can in turn make gum disease worse. I had a friend, Sarah, who had been battling diabetes for years. Her blood sugar was always high, and she noticed her gums were becoming increasingly swollen. After some time, her dentist pointed out the connection between her uncontrolled diabetes and her oral health issues. She made changes to her lifestyle, improved her blood sugar management, and as a result, saw improvements in her gum health. Lifestyle adjustments for better oral and heart health. A healthy lifestyle goes hand in hand with oral health. Exercise, eating a balanced diet, and maintaining a healthy weight can help lower inflammation in the body, including the gums. Keeping your muscles strong and staying active reduces the risk of prediabetes and improves circulation, which in turn helps keep your gums healthy. For instance, my friend Jen started incorporating more whole foods into her diet, like leafy greens and fresh fruits. She also began walking every day to manage stress. Not only did she lose weight, but her oral health improved as well. Her dentist noticed less plaque buildup and her gums were healthier. What to avoid in oral care: DIY scalers and harmful products. There's a common misconception that using DIY dental tools, like home dental scalers, is a good idea to remove tartar. While these tools might seem tempting, they can cause significant harm to your gums and enamel if used incorrectly. Instead, leave tartar removal to the professionals who have the training and tools to do it safely. Here's a funny but cautionary tale. My friend Chris once tried using a DIY scaler he bought online, and after a few minutes, he ended up with bleeding gums and worse tartar buildup. Lesson learned: always leave it to the pros. Debunking myths: the truth about homemade remedies. Many people turn to home remedies for plaque and tartar removal, like using hydrogen peroxide or chili pepper paste. While these remedies might seem effective, they can actually harm your gums or enamel in the long run. The best approach is regular brushing, flossing, and professional cleanings. I once tried using baking soda on my teeth, thinking it would whiten them faster. While it did the job, it also made my gums sensitive for a while. It was a reminder that moderation is key when it comes to DIY methods. Conclusion: your oral health is a reflection of your overall health. Taking care of your oral health isn't just about a pretty smile. It's a vital part of your overall health, directly affecting your heart and body. The good news is, by following simple daily habits like brushing, flossing, and using water flossers, you can significantly improve your oral hygiene and reduce your risk of heart disease and other chronic conditions. The key takeaway here is that your health is in your hands. Don't wait for a wake-up call like my friend Linda's. Start taking care of your mouth now, and you'll reap the benefits for years to come. Lessons learned: consistency is key. Brushing, flossing, and water flossing are non-negotiables for maintaining oral health. Preventing heart disease. Oral hygiene and heart health are linked, so keeping your mouth clean may lower the risk of serious heart problems. Lifestyle changes matter. Diet and exercise can help you maintain both oral and overall health. Don't DIY everything. Avoid using harsh homemade remedies or dental tools. Leave that to the professionals. So, go ahead, grab that toothbrush, and make a commitment to your health today.